Welcome to Module 2 of the REACH Parent Program. The first module of the program introduced you to characteristics of the post 9/11 combat era and the common injuries and disorders many troops experience. This module addresses the challenging emotions your loved one may be struggling with, as well as the behaviors that can develop because of these emotions. Strategies for helping your son or daughter manage these emotions and behaviors are included. We hope you find the module will help decrease the burden that you as a caregiver carry. In addition to attending to your adult child's medical needs, you may find yourself having to contend with your loved one's emotional and psychological needs. Your child's moods may range from happiness to sadness and fear to frustration. He or she may have periods of grief and even jealousy of those who are able-bodied. There may be feelings of guilt that he or she is not in combat helping his or her comrades, or guilt about having survived if others lost their lives. Your loved one may be depressed, hopeless, or emotionally distant. Your adult child is at risk for developing mood orders and for turning to substance abuse to cope with physical and emotional pain. The main thing you can do to assist your loved one is to provide patience and understanding as they cope with the responses to trauma. You can strive to be steady and calm when your loved one feels out of control. Show respect even when your loved one is not being respectful. Keep in mind that your adult child is no longer a child but an adult. Do not talk down to them or behave as if you know what's best. Do not discount or diminish what they are feeling. The goal is to comfort, not control. Communicate with your adult child. Encourage your loved one to ask for help when needed, to talk about feelings and thoughts when he or she feels like it. Be sensitive about discussing your adult child's condition with others and respect your adult child's privacy. Communicating openly with your loved one about problems can strengthen your relationship if you do so with compassion instead of blame. Talking about things as soon as they come up can help avoid future conflicts. If you try to see each situation from the other's point of view, understanding and respect will build. There are definite roadblocks to communicating with your adult child, which will interfere with you being able to assist with emotional or psychological issues. Not listening is one roadblock. If your loved one is sharing with you, pay attention and listen carefully. Try not to be close-minded about what your adult child feels is best, and try not to pass judgment on choices or behaviors that may be out of his or her control. Regardless of how upset you may feel, do not reject your adult child, even temporarily. This shuts down communication and trust. Do not criticize attempts to get better or to control behaviors. Do not make demands on your adult child. Use polite requests to encourage the actions you want. Sleep disturbance is another common problem for troops returning from deployment. Things that can disrupt sleep are the physical injuries, stress, anxiety, and depression. Both you and your loved one need sleep to help cope, concentrate, and stay positive. Good sleep habits are essential. Make sure the bed is comfortable and supportive. Establish a bedtime routine that avoids TV or computer time. Try to be in bed by 10 p.m. Avoid caffeine and alcohol for a couple of hours before bedtime. Therapists recommend using stress management techniques such as attempting to slow your thoughts once in bed. You might try repeating a calming phrase in your head or visualizing somewhere peaceful and serene. Stretching, as well as purposefully flexing and relaxing the muscles while lying in bed, can help. Many find that a hot shower or bath can also help signal to your body that it is time to sleep. If nothing seems to help, tell your healthcare provider. They may order a sleep study or prescribe medications to help. Pain can disrupt a person's activity, mood, sleep, and overall outlook on life. It is also difficult to witness other people in pain because of empathy. In fact, research has shown that watching someone we love suffer impacts our own well-being. Often, pain will dissipate slowly as an injury or surgical site heals, but this may not always be the case. Enduring pain takes a toll physically. It makes you tired, and it affects your ability to cope emotionally. A patient's ability to communicate about pain is vital to the doctor's ability to treat it. Controlling pain can make your loved one feel both physically and emotionally better. Help your adult child learn to communicate about pain in this manner. Think of a pain intensity scale which ranges from 0 to 10. 0 indicates no pain at all. 10 is agonizing pain. The lower levels are tolerable, the middle levels are distracting, and the upper levels prevent normal activities. Help your loved one describe the pain. Is it aching, burning, sharp, twisting, dull, or does it feel like an electric shock? Keep a journal about how often the pain is happening and at what time of day. There are apps you can use to log pain. If there is a sudden increase, note what was happening when this occurred. Explain to the doctor how the pain affects day-to-day living. Remember, pain, and especially chronic pain, can take a toll on your adult child's emotional health. It increases the risk of depression, anxiety, and PTSD. It also increases the risk of suicide. Your loved one may be irritable and moody, or extremely tired and even fearful. Talk to a healthcare provider if you are concerned about the emotional impact of pain on your adult child. A doctor will most likely prescribe pain medication, which should reduce pain. Be aware, though, that some pain cannot be entirely extinguished by medication, and a 0 pain level is often not realistic. The goal is to reach a threshold that your adult child can live with. Some medications take time to work and build up in the body's system. Help your adult child commit to sticking with the management plan for a specific period of time before deciding that it is not working. Stretching and massage can also help alleviate pain. So can meditation and exercise in some cases. All of these activities help bring blood flow and oxygen to injured sites and help muscles to relax. Some therapies can take 6 to 8 weeks for noticeable improvement. Doctors can tell you what to expect over time and set goals. Support groups for pain, in person or online, with other chronic sufferers are available that may help ease the isolation many sufferers feel. Remember, anything that helps reduce stress can help reduce pain. So, focus on eliminating as much stress as possible. It is not uncommon for service members to self-medicate their pain, both physical and emotional, with drugs or alcohol. They find that using substances relieves pain, relaxes them, or helps them escape. These effects are temporary and can ultimately make issues worse. If you believe your loved one may be self-medicating, let the doctors know. Substance abuse can mimic other disorders and can lead to misdiagnoses if the doctor is unaware of the issue. At what point is your adult child mis or overusing alcohol? The medical world states that 5 or more drinks on one occasion, on 5 or more days in the last month, is indicative of addiction. If your child chooses to drink alcohol, the recommended guideline for men is 2 or fewer drinks a day or 14 or fewer in a week. For women, no more than 1 drink a day is recommended, or no more than 7 drinks a week. Just what is considered 1 drink? 12 ounces of beer, 4 ounces of wine, or 1.5 ounces of liquor. None of these are large amounts if you measure carefully. Remind your loved one of the health impacts alcohol has, which include liver and lung disease, stomach ulcers, malnutrition, psoriasis, and long-term cognitive impairment. Immediate repercussions include impaired judgment, vomiting, and injury due to fall because of loss of balance. The following questions, called the CAGE quiz, help determine addiction. If you are worried, ask your adult child to answer them honestly. Have you ever felt you ought to cut down on your drinking or drug use? Have you ever been annoyed by others' comments about your drinking or drug use? Have you ever felt guilty about something you said or did while under the influence of alcohol or drugs? Have you ever had a drink first thing in the morning as an eye-opener? If the answer to any one of these questions is yes, further evaluation by a medical professional may be necessary. There are many local external and military groups available to help treat addiction. An important fact to remember is that addiction has nothing to do with willpower. Addiction is a chemical state of being. Alcohol, marijuana, prescription, and illegal drugs are biologically addictive. Signs of abuse can include memory loss, fatigue, agitation, confusion, depression, anxiety, changes in blood pressure, abdominal pain, sleep disturbance, and appetite disturbance. These are all symptoms of other illnesses as well, but if tied to substance abuse, they may dissipate when the drinking or using stops. When prescribed by a doctor and used as directed, prescription medications can effectively treat pain, depression, PTSD, sleep disorder, and anxiety disorder. These are also medications that are prone to abuse. Keep in mind too that many cannot be taken with alcohol. Consult a pharmacist if this may be an issue. Most recommend you do not take over-the-counter medications such as aspirin, acetaminophen, or cold or allergy medicines when drinking because they interact with alcohol. Sleeping pills, pain pills, depression, anxiety, and even ADHD medicine can also have a bad interaction with alcohol. Not all overdoses of prescription medication are intentional. According to the CDC, 91 Americans die every day because of painkiller overdose. Most of these deaths are accidental. If you suspect overdose or alcohol poisoning in your loved one, do not hesitate to call 911 immediately. There are numerous resources online to help with and treat addictions. Alcoholics and Narcotics Anonymous have tried and true programs and are located just about everywhere. The internet will provide local phone numbers to call to inquire about meetings near you. Families Anonymous can be reached at 1-800-798-05. A national hotline for referrals is 1-800-421-4321. The VA medical centers have inpatient and outpatient treatment facilities and support groups. Go to www.findtreatment.samhsa.gov for other military options. The National Council on Alcoholism and Drug Dependence can also be reached at 1-800 622-2255 or by going to www.ncadd.org. Many of the challenging emotions your adult child may be feeling may have nothing to do with physical pain. There are many emotions tied to losing one's independence. Your adult child may now be dependent on others to do things that he or she did before. To counteract the focus on loss, help your adult child focus on strengths. What are all the things he or she is still capable of and responsible for? Ask your loved one to talk about these feelings openly and try to have a sense of humor when something awkward or funny happens as the two of you adjust. Encourage your adult child to participate in activities they are capable of and that bring joy or a sense of accomplishment. Being social takes energy, and at times your adult child may feel unable to exert enough energy to socialize. Some victims of trauma struggle with depression, anger, trust, and simply don't feel happy or secure enough to want to be around other people. Mobility may be an issue. Embarrassment may be an issue. Don't force situations. Encouraging your loved one to see friends and make friends is great, but it may need to happen at a slow pace. Let your adult child control the social meeting. When, where, who, what. Ask your loved one what would be best. Pre-plan as much as possible. Are there accessibility issues? Do you need to let people know what to expect, what would be best in advance? Some people are simply uncomfortable around injured people, but with time and exposure, they can acclimate and become comfortable with your loved one too. Be patient and forgiving and try not to take other people's reactions personally. On this slide are only a few organizations that are devoted to helping wounded military service members maintain healthy, active lives and provide the socialization of teamwork and friendship. You may wish to screenshot this slide or take time now to visit or bookmark these sites. Many of them will be available at the end of the webinar series. Hygiene and particularly body odor can become problematic in injured people for many reasons. Your loved one may be attempting to bathe or shower thoroughly, but disability may be preventing this from happening. The need for independence or embarrassment over needing help or being undressed in front of others may be an issue. Your loved one may have suffered an injury that impacted cognitive functioning, and the fact that they need to brush their teeth or hair may not be something they remember. It is not uncommon for anyone suffering from depression to stop practicing good hygiene. Fatigue can set in, and even though your loved one gets in the shower, they may feel so exhausted that they simply don't use soap or attempt to get clean beyond getting wet. If your loved one suffered a spinal cord injury, the ability to control bodily functions may have been affected. Work with healthcare professionals to deal with this. Lastly, pain may be preventing your loved one from caring about or performing good hygiene. Be patient, be direct, let them know it's an issue, and ask how you can help. Online shopping is a convenience many Americans use almost daily. For those with compulsive spending habits, though, the access to credit and shopping without leaving the home is financially dangerous. Compulsive spending is a disorder. If your adult child is racking up debt that cannot be paid off, you may need to step in. If you know that your loved one's cognitive abilities are impaired, perhaps by PTSD, depression, or TBI, you may need to get a letter from the doctor and start contacting the credit card companies. Failure to pay debt can cost the spender tens of thousands of dollars in interest over time. repossession of items purchased, foreclosures on homes, banks refusing to loan the spender money, and even legal problems. Some employers run credit checks on potential employees to gauge how fiscally responsible they are, so a low credit score can cost a person a job. If you can, stage an intervention. Enlist the help of a trusted friend or family member. Have copies of bills if possible. Have your loved one seek help from a mental health professional. If your loved one will hand over the credit cards and allow someone else to take over his or her finances, even temporarily, this is beneficial. Protect yourself. Your loved one may be opening lines of credit using your or your spouse's name and social security numbers. Your bank may offer a free credit check, or you can go online to TransUnion, Equifax, or Experian. Look for fraudulent use of your credit, and if you find any, report it immediately and have the cards canceled. Do not pay your loved one's debts. Allow the natural consequences. Or, if cognitive functioning is an issue, contact companies with documentation of the injury. Anyone can feel depressed at times. There are legitimate reasons for sadness, and allowing oneself to be sad is healthy. When the sadness progresses for weeks at a time with no cessation, it may be clinical depression. Signs of depression include feeling sad, anxious, empty, hopeless, helpless, worthless, or even guilty. The person may suffer from aches and pains not caused by illness or injury that do not respond to treatment. The person usually loses interest in activities they previously enjoyed. The person may express thoughts of suicide or death. He or she may gain or lose weight suddenly. In addition, you may notice the person is unusually tired, restless, or irritable. Clinical depression is caused by an imbalance in the neurotransmitters that regulate sleep, emotion, and the ability to feel happiness. This imbalance can occur because of genetics, but it can also be brought on by prolonged stress and trauma. It can also occur because of alcohol or substance abuse. A specific life event may trigger it, which includes severe illness or injury. The depressed person is unable to snap out of it, and to suggest this is wrong. People with clinical depression need medical help to treat the disorder. In addition to medical intervention, you can help your loved one develop habits that will help the body fight depression. Encourage your loved one to shower, dress, and look nice. Many times when we look better, we feel better. Encourage your loved one to get plenty of sleep and to not drink alcohol, which is a depressant. Encourage a realistic daily routine which helps your loved one stay active. Exercise can help alleviate depression because it increases endorphins in our body, which give us a sense of well-being. Encourage your adult child to participate in the fun activities they enjoyed prior to their injuries. Depression does not disappear quickly. Make sure and get professional help. Medication and counseling combined is often the most effective treatment. Help your loved one to stick with treatment and make the changes the doctor or therapist recommends. Lastly, if for any reason you believe your son or daughter is suicidal, call 911 or the National Suicide Hotline at 1-800-273-8255. Caring for your injured adult child presents many challenges. Among these are behaviors that result from your loved one's challenging emotions. Dealing with someone who is acting out, not being cooperative, or not taking good care of him or herself is difficult and stressful. Living with and caring for someone experiencing sleep problems or managing pain is also difficult. Utilize the strategies in this module to try and decrease the burden on you and to alleviate some of the struggle your adult child is facing. However, if you feel your loved one needs additional help, seek it. This concludes Module 2 of the REACH Parent Program. In the next module, we shift the focus to you and address things you can do as a caregiver to take care of yourself.